Hi class, welcome to the second video in the cultural factors in childhood psychopathology. And in this video, I want to now focus in a little bit more on children themselves and why this is so important. So something that I really want to cover is the fact that there are health disparities. This is especially a fact in the United States, but we have a lot of people from underrepresented minority groups, from race and ethnicity, so things like, being Black or, being Hispanic. Though individuals in these groups are disproportionately affected by issues in mental health, and there is a disparity here in how treatment is had. So health disparities do exist. So what do we mean by health disparities? The National Institutes of Medicine define it as difference in treatment or access not justified by difference in health status or preference of groups. So this isn't to say like, oh, well, I prefer to go to, a holistic doctor rather than go to a psychiatrist, for example. This is really that there are some systemic issues happening where individuals who are like of African American descent or are Latino or LGBTQIA have greater barriers and greater issues when it comes to treatment and access to care. So these health disparities are impacted by and caused by things like risk factors that we know already exist for psychopathology. So things like poverty, food insecurity, exposure to violence are all risk factors for mental health issues. The actual mental health needs that we have, there may be a difference in some of the needs that we have, and that can impact our access to care. Our access to formal mental health services, do we even have it in our communities, and other barriers to treatment. So I wanted to focus on a couple of these, which is poverty. I also want to talk about diagnosis and how that may differ based on culture, and then talk about some of those barriers to treatment. So starting off with poverty. So how may things like economics, so being in poverty, how might that actually drive health outcomes? I really like this graphic from Kaiser, which kind of goes into all the different things that are impacted by economics. So things like our economic stability, what the neighborhood is actually like, our access to education, right? So you might not have as great of an access to education if you live in a neighborhood that is unsafe. You may have food insecurity. There may be a lack of support systems in your community itself. And then the healthcare system might have issues as well. They are all driven by economics. So if you're in a lower income community, that is going to drive your access to care. It's going to drive every single thing that a lot of these risk factors for psychopathology. Another thing that I really liked about this is that it really does highlight racism and discrimination as underlying all of this. Unfortunately, the United States has had a long history of discrimination and racism that really impacts things like intergenerational wealth. So policies like redlining have been historically something that's happened in the United States, where it was limiting where Black individuals could live. So if there was a community of white individuals, that Black individuals were not being sold homes in those areas. This impacted everything from, our economic stability, for example. You're not allowed to buy a home here, so now you have to buy a home elsewhere, which might impact your neighborhood, right? You might not have as great of a neighborhood. You may have less access to education, for example, because your neighborhood doesn't have as many tax dollars going into education. It may you may have a food desert where you live, right? So not having access to healthy foods, and that might impact things like your healthcare system as well, right? If you're in a low income community, and that's the only place that you're allowed to buy a house, they may not have access to a good healthcare system, for example. I'm sure I have resources out there about redlining, but this will really show you how this can impact kids, right? So if you have this historical thing going on where, well, you don't have access to intergenerational wealth because that was really done by a lot of housing, for example, and you're stuck in poverty, that this might really impact you in the future. So one of the things that I really want to emphasize here is that poverty disproportionately affects individuals who are of a racial or ethnic minority. So it's quite sad that 19% of children in 2016 are living in poverty. And this is children under 18, so 1 in 5 kids are going to be living in poverty. And this changes based on your race or ethnicity. So for example, white children are about 11%, whereas black children are 34%. And if you know anything about our country, Black and Hispanic individuals don't make up, 70 whatever percent of the country, but yet they are making up that much of the children living in poverty. Same thing with American Indian and Alaskan Native. It's a pretty high percentage of individuals living in poverty. And this is children. So 1 in 3 American Indian and Alaskan Native, 1 in 3 Black children, and almost 1 in 3 Hispanic children are going to live in poverty. So if you consider that poverty and economic status impacts everything, basically, where we live, what type of education we get, access to violence or exposure to violence, all of that is going to impact our rates of mental health. And this was 2019 data, so it was before the pandemic. Child poverty rates have dropped to an all-time low since the 1980s. I just wanted to show you that this is sad to begin with. But even then you see that Black and Hispanic individuals are more likely to be in poverty than Asian or white children. This is children, again, got to put that into perspective. So poverty really is disproportionately affecting Hispanic and Black children. And that can have a direct impact onto things like mental health. Just want you to let that sink in.